We may still have some folks hopping in, but I do want to be respectful of folks' time. Just point out that the meeting is being recorded and you'll be able to reference it later. We'll send it out. I wanted to thank everybody for joining. My name is Allison Clark. I'm a new member of the PHS team. My role is Senior Director of the Whole U NYC SCN. I'm very excited to meet with you all today and carry forward a bunch of the topics we met on last time, but also save some time for discussion for a few items that are top of mind for our collaboration going forward. Before I jump into the agenda, I wanted to give Zach Hennessy and Keisha Barr of our leadership team here a chance to go ahead and introduce themselves, and then we can get started. Zach.
Thanks, Allison. Welcome, everyone. It's great to see you all. We very much appreciate your patience as we have been working towards executing these agreements. I think both for SCNs and for plans, both stakeholder groups had a lot of questions for the state as it related to various terms and requirements in the contract. And so we appreciate your bearing with us as we have worked with the state to answer those questions. I am pleased to say that we have answered all the questions that we need to have answered in order to proceed with executing these agreements on our end. And that was indicated in our kind of releasing a new contract package for you, I believe, last week. So we hope now that we can, really move towards executing with all of you. And I do apologize, but at 9:30 I have to jump for another meeting, but you're in good hands with Allison and JP and Keisha.
Hi, thanks, Zach. I'll just echo everything Zach said. Keisha Barr, Managing Director, Whole U NYC. I echo everything Zach said and just looking forward to working with you and your teams over the upcoming weeks and years to enhance care coordination for your members.
Thanks so much, Keisha. So I mentioned at the top of the hour that we'll pull in some topics from our recent October meeting, as well as dive into several key points for discussion around the collaboration between PHS and the MCOs. And I'll just move on to the agenda. We'll focus on just a quick review of our key SCN implementation milestones and the summary status, review of some implementation activities for the SCNs and MCOs, and focus our discussion on member communications, data sharing and collaboration, payment and claims, the core reporting updates, and just review and share some resources for you and your teams. The next slide. So just to highlight, as you know, on your side, there are many moving parts in standing up this network for serving the citizens of the state of New York who need these enhanced Medicaid services. And we will just highlight from our side that we formed a governance committee and it is meeting. We are working diligently and furiously on IT systems build out with our IT partners. We've established stakeholder work groups like this, meeting with you, but also meeting with our SCO network providers and so forth. And we're working hard on setting up training resources and an implementation plan for training. And then also just as you are, we're working together with the CBOs to finalize their agreement. And then on the next slide, just want to highlight some implementation activities that come from the agreement as well as the operations manual. Sorry for the small font, but we're really focused on all of the details as well as the big picture that's required to stand up this initiative and collaborate effectively together. So really, as you well know, the categories of our activities really pertain to contracting, member communications, payments and claims, our coordination on care delivery, data and IT as well, and then onboarding activities as we get closer to go live.
Hey,
So the
Allison, so
first-
is it worth
Yes.
maybe just walking through the list so that we can get alignment from the group that these are all of kind of the implementation planning activities and decisions that we need to make over the upcoming weeks? I'm not quite sure if we've had that discussion, and it might be worth just us aligning on this list.
Sure, I think that's great, Keisha. Thanks. We can rewind and just focus in on the details. And then I think also it makes sense to just coordinate around some of the traction that's been made in the interoperability work group where folks are involved there, because I think there's some good movement on some of these items. So that's exciting to share as well. So around contracting, Zach summarized that at the top of the meeting, executing as soon as possible the MCO agreement and the associated BAA. And around member communications, we'll talk about that in a moment, confirming with you the information that you require in order to communicate timely as required by the state toward the members being informed about the network. Couple of topics around payments and claims, the PMPM administration process, and all of the implementation timelines, as well as the coordination of the various steps there, payments and claims relating to the submission of our services claims and the process for timely and accurate claims to the submissions to the MCO. Then several topics around care delivery and how we coordinate such that our systems have up-to-date information around members. And the first of those is care coordination as it pertains to the member disenrollment process. And that's one of the pieces where OHIP and NICE are developing a separate mechanism to assist the SCNs with identifying members who were disenrolled or moved out. So that's one place where we've had traction there. And then in addition to just disenrollment itself, around care delivery and care coordination, defining the SCN MCO identification of member eligibility for the enhanced services, for example, pregnancy, care delivery around care coordination, defining the member movements across regions, as well as care delivery, defining the SCN MCO coordinated case management process, and care delivery coordination around SCN MCO duplicative services, ensuring that we are well informed and services go to discrete needs and we don't have duplicates. SCN care delivery around defining SCN MCO member grievances and appeals. And then a bulk of work on SCN data and IT. One topic is the MMCOR reporting, aligning on what needs the MCOs have for their MCOR reporting to OHIP, and confirming the needed data elements. And I believe there's guidance forthcoming from the state on those. The SEN data and IT workstream, again, relating to enhanced services member files, which are one directional at the current moment, and how we maintain what updates are required there. We are collaborating with HealthX and our technology partners to confirm our ability to ingest the file directly into Unite Us and hyphen if applicable. The last one is around SEN onboarding, and this is to confirm whether you will provide support for screening and navigation, or what your plan is for the workflow in your own organizations. If you do plan on standing up screening and navigation within your organizations, there is an onboarding and credentialing that would be related to taking on that work. So I know that's a lot. I'll just pause there. Okay, so we wanted to take some time to really, did we get any questions around the run through there of all the implementation activities?
Not in the chat.
Okay, definitely let us know if you have any questions. We want this meeting to be an effective discussion since there are so many moving parts and requirements for our collaboration. So please let us know. All right, I can jump right in then to our collaboration activities and our discussion topics for today. We want to just confirm in terms of member communications, understanding that you'll distribute member notices with information about the SCN and collaborate with OHIP for your review of that information, and update your member handbooks with relevant information. Again, using OHIP guidance. And we wanted to confirm in terms of your member notices, which data points you need for those communications. We're tracking network name, phone number, an email for member inquiries, and of course, a website for members to contact us. And I think it would be helpful for a little discussion regarding your plans and your plans around January 1st as opposed to the release date of the communications, because the state is requiring those to be put together sooner. And I wanted to confirm that we, on our side, will provide you with our SCN phone number by this Friday. So you'll have that to include. Are we missing anything in this list?
So just to clarify, Allison, this is information you want to include in our member notices?
Yeah, the state is requiring that the MCOs distribute information to their members prior to January 1st regarding the availability of the services that are provided by the SCN.
Right. So those member notices, those templates have already been finalized with the information that we had, for example, for PHS. So what I'm saying is that horse has left the barn in the sense that those mailings will start going out 11/18, and we can't make changes to those templates. So yeah, that's essentially what I'm saying is that is the information that you have different than what I guess was previously shared?
Well, we're planning to provide you with a dedicated phone number for our SCN. Where did you source the information that you're using for the member notification?
I believe from PHS. We sent in requests previously.
Hi, this is
Okay.
Kevin from Medicare, Allison.
Yeah.
I want to definitely echo what Mohammed said. The letters, the 30-day letter is a structured letter that goes from the Department of Health to the MCOs. We make basic changes on it, but it goes to all our membership, so it would not have anything specific around PHS on it because we have members through all the boroughs. What
Yes,
we're hoping, and I know that we had Allison, I think it was you and I that were emailing. We were hoping, just to get more information, like what you're showing here, maybe as a separate document that we can send out to our members that live in the boroughs that PHS covers, and also do the same for the, for the other two, for Somos and whatever the Staten Island name is. I don't know. It seems to have changed a few times. But anyway, so yeah, just that's our biggest concerns coming from Medicare is when that 12/1 letter goes out, which is ours is going out on 11/22, the phone lines are going to be jammed.
Yes,
So
yes.
yeah, so any type of information that you can provide to us, so we can say, okay, you're in Manhattan, we'll send you this, and then we'll also work with the other SCNs on that. But like just echoing what Mohammed said, that letter is a very general letter about the 1115 waiver.
Yeah,
Yeah, I
just
just want to
one.
echo. I just want to echo what others said. We're just required to put a phone number in there, and we put our internal member services phone number. And
Okay.
the idea was that we would have basically a talking points and cheat sheet for our member services that would have every SCN's contact phone number, the hours of operation for that phone number, understanding that some may not be live on January 1st, but some may be, and maybe it's just Monday to Friday, things of that nature, and the website, because that will be necessary, because if it's in members' hands by mid December, people may start calling us, and we're going to have to figure out based on their address which SCN they're assigned to, and then give them the information for that SCN. So this is very needed for us to make sure that our customer service people have the right information, but it's too late for the letter.
Right,
And also it would be difficult.
I agree with Caroline. We just put our member services.
Yeah, I just want to clarify that the discussion topic here is more of a question to understand from you guys based off of what communications needed to be updated for the SCN, given any guidance from OHIP and timelines around them, what information you require from us as an SCN to feed any updates to those notices. And so it sounds like, though, we have received some emails from some of our plan partners on the line requesting some of this information to update communications. For example, it sounds like Mohammed at Health First, you guys did include some of this information and things that are going out. And so I think what we want to clarify is, what information do you need from us to feed any updates that you're making to member communications to ensure that you can meet some of the deadlines and deliverable dates that OHIP might have provided to the MCOs regarding these communications. And so it sounds like there might be a different approach for, across health plans in terms of what SCN specific information you are putting in your notices. But it also sounds like there's a need for us to communicate at a minimum phone number, hours of operation, and website. We just want to ensure we get you the information that you need to feed any updates to your member-facing communications to meet the state's requirements on your end.
Thank you, Keisha. Yeah, this is Kevin again from Medicare. Totally agree. I mean, we're going to do a separate mailing. And so if we were able to include this information from all three of the SCNs that we're working with, that would be great, from our end. So that's very much appreciated.
Okay, so what I don't see on here, Allison, that I think Caroline, you mentioned, is hours of operation.
Okay, thanks.
Yes, please. And also just when the phone number will be live. We don't want to start giving people the phone number in mid-December if it's not going to be live until January 1st.
Hi, this
Yeah,
is
do you-
Josiah from Medicare. I just have a question about when the phone number actually goes live on January 1st. How prepared will you be to handle all of these calls? Because like Kevin said, we expect a high volume of calls because of what the letter says we're offering. So for January 1st, we also expect a high volume of calls from our members to try to get these services. So how prepared would you be on January 1st to be able to handle all of these calls?
Yes, we're working on standing up the required team and the infrastructure with our telecom, as well as supporting our partners and being available and able to field the high volume of inquiries. We recognize that it will be a high volume because there will be such high interest in the newly available services.
Thank you.
I think there's a question, Melissa.
Yes, the question is, what is PHS preferred method if members have inquiries, phone, email? What is the most efficient way to meet the members' need? And Zach had said, for those who had previously requested, we provided the number to our coordination center, which is staffed by individuals prepared to answer questions. The new number will be more SEN specific, but staffed by the same team members.
Yeah, I just wanted to provide a little reassurance that we have had a coordination center for a few years that kind of handles requests for services from our network. That is expanding. And those who requested the telephone number earlier, before we were setting up a new number, that was the number for our coordination center. It's led by the same team here, staffed by navigators. And so, yeah, we will be prepared for calls that come in for members. So, yeah.
I think also speaking to the question from Liz in terms of the preferred method, I believe we'll be also having an email for members who would prefer to communicate that way, in terms of just whatever access point for members to ask their questions. I do believe phone may be the preferred method. Please, if anyone on the team wants to correct me or update that information, but I think whatever works for the member ultimately.
Yeah, we can meet the members where they are. And we'll have the telecom and the email and the website all ready to go and being staffed on our end.
And it's also important to note that there is a requirement for the SCNs that we provide, SCN directories and even the ability for someone to self-screen on our website. And so we will be enhancing our website as well. So that's also, an opportunity for members.
Hi, this is Rita from Metro Plus, and I have a question. So if we are on schedule to mail out these notices, which our members might receive by December 1st, are the SCNs prepared to answer questions or handle any inquiries from members during the period between December 1st and January 1st?
Yes.
Okay, so if a member calls, then we can give them the contact information prior to January 1st, correct? That's what you're saying.
Yes.
Got it. Thank you, Zach.
I want to note that currently our coordination center is only able to navigate individuals to existing social safety net resources. And that will be the case for anyone who presents to us with an unmet need. And so prior to January 1st, we're not going to be providing any of these enhanced services prior to January 1st. We will only be navigating to the existing social safety net. Like if someone came to us and they said, oh, I hear I can get these new meal boxes, we will have to tell them that those are not available until after January 1st, but we can support them in navigating to existing resources in our network.
Got it. Thank you so much.
Thanks, Zach. Super, very helpful to hear your questions and understand how you're organizing on your side in preparation for these multiple touch points with your members so we can broaden awareness. Okay, I think we can move along to some of the meat of the data sharing topics. There are multiple, obviously. And I think that there's like I said in the beginning of the meeting, there is some traction in terms of leveraging as much as possible any IT systems that can be useful to validate information as real time as possible. But we do need to discuss how the SCN lead entities and the MCOs can work together to ensure member information is updated. We have responsibilities around collaborating with the MCO has a responsibility around collaborating with the whole U NYC to establish a communication workflow for eligibility changes and updates. If you were choosing to utilize the our IT platform for screening and navigation, as I mentioned earlier, there's a process for credentialing for training and access to that system. And we also wanted to discuss establishing an SCN MCO member grievances and appeals process, and hear your thoughts around maybe work you're already doing, if you have models you want to replicate here, and what your contact information would be. Just to share a little bit of context here, the SCNs will be expected to verify member coverage in MEVs. And we're looking to understand what the defined process should be in terms of communicating back to you updated member information. The state has defined tight timeframes for these communications to occur. And the MCOs must identify a point person and develop a workflow to intake service requests from the SCNs to incorporate updates to eligibility following members of eligibility assessment in the SCN process.
So I think we could probably group some of these into like categories and maybe start with kind of the care delivery process. There is an expectation based on the requirements in the ops manual that we establish some bidirectional communication streams during the course of, you know, care delivery to facilitate the sharing of information, whether it be the SCN being made aware of member eligibility for enhanced services. Let's say, you know, pregnancy is a good example, right? When that information didn't come over on the ESMF file, or, you know, the MCO, you know, being informed of member disenrollment and now needing to get that information to the SCN to ensure that we can kind of see services as appropriate, or a member moving across region. And there are a couple of other examples and kind of use cases that warrant us sharing information during kind of the care delivery, care coordination process. I think there's a couple of others where if we're aware that there's a case manager on your side working with a member, like how do we collaborate? And so I think that's kind of one bucket, and really thinking through like what our preferred process is. Also knowing that from a PHS perspective, we're contracting with 15 different managed care organizations. And so in an ideal world for us, the process is as consistent as possible across all of our health plan partners. And so one of the things that we were thinking about initially is, well, we're talking about sharing like Medicaid data and, you know, eligibility data, and, you know, it's not something that we can send in an email to our partners. And so, you know, could there be, or would you be open to, if we could solution for some sort of an SFTP process where we're sharing this information back? Of course, we'd have to work through the logistics, timing, and delivery and files and all of that. But like, what would be our preferred mechanism for sharing this information with each other, knowing that there are some requirements of us to share this information real time or near real time to support care coordination. And I know a few of our partners on the line actually had proposed an SFTP earlier in the contracting process, but you know, that may be something that we can explore further if you think that that would be an ideal means of sharing this information back, given the kind of information that is going back and forth between our organizations.
Hi, Keisha. This is Laura. I think that considering this date, I don't know if it's 3 or 5 days, has an SLA like turnaround for any mid month eligibility changes and updates for members to get back into those files. Um, some SCNs want to share that more regularly, like a daily file. Some are opting for weekly, but I feel like it'd be great to kind of get some consistency across the board. So, anything we can do to standardize, that would be great.
And then just to clarify, I think Laura, just following up on your statement there, the mid-month changes, we're specifically talking about the flag changes and not necessarily disenrollments or change in SCNs, because per the FAQ, that will be handled by DOH. They're developing the MEVS tool, and that will be the source of truth and where all the SCNs will be going to get that information. Is that everyone's understanding? That's what we've gotten as of the last FAQ.
Yeah, so yeah, thanks, Mohammed. Yeah. Okay, so key takeaway is working toward consistency as much as possible, such that that information can be ingested into your systems timely. And did we have any other questions in the chat?
I had one
Comments?
question. I'm not exactly sure if this is what was just asked, but if a member moves and their address changes, meaning they're going to be moving out of your SCN into another SCN's region, is that something that we will need to communicate to you?
I think so, Caroline. I was trying to pull up the operating manual to find the actual language, but that was also one of those requirements around notifying the SCN of that so that we can, address that accordingly with the services that are being rendered within the network, and also collaborate, with the other SCN to hand off, information as need be.
Mm-hmm. Okay. And so does it seem like there's consensus, and I'm just sort of saying this across to the group, about using this SFTP process and that being, the preferred mechanism for sharing this data?
Just also going back to your first point there, Caroline. So I think that even that when a member switches SCN, the state would have the source of truth in their eligibility tool that they're building out. We would, for example, put in our changes, whatever happens based on the monthly file, the monthly ESMF file that we're creating. Any address changes has to hit the state system at 834. We do our billing based off that. Our ESMF file gets created based on those addresses, and that's what's getting pushed out to the Shiny, and then to the QEs, and then SCNs.
But isn't that how we also get the disenrollment data too?
Yes, that tool will be the source for disenrollment, eligibility changes, all of that.
What tool are you referring to, Mohammed?
It's in the FAQ. I think it's the MEVS.
Oh, the
tool.
MEVS,
Yeah.
That they're developing, and
but then what are we communicating mid-month?
Yeah, I think if you believe like the step in the process where, for example, the navigator or the person on the SCN goes into MEV, if you believe some of that information would be updated real time or near real time in MEV, that's the solution. But I will say that there are some specific areas in the manual where the state does say explicitly that we need to establish some kind of bidirectional sharing processes to share this information. And so I think the question is, what information would be most appropriate and updated timely for the navigator to utilize MEV getting to receive, and then what are the gaps that we still need the solution for via some other process, because it's not going to be readily available and accessible in the MEV tool, because there are some specific requirements around that in the manual.
Right. Yeah, we did see that as well. And then, I know here at Health Force we had a couple of back and forths with the state on this, and since what you were putting it in the, for example, in the agreement, but your guidelines, your FAQs state something else, that there will be real-time eligibility check tools that will be integrated with the SEN IT platforms that the SENs can use. So and that's where they sort of clarified that we'll be releasing in a subsequent FAQ that the tool will be the source of truth, and that's what you will have to use.
Okay, so you're
Yes,
thinking
right.
that MEV would be our source of truth for notification of any I don't want to say off cycle, but any disenrollments, member movement across regions, and what were some of the other things? I just want to ensure that I kind of get them.
I think member address changes. That's the only thing. And again, this was based as of the last guidance we received from the state, and we're hoping they will put this in an FAQ.
Yeah.
But we do have it in writing.
Okay. And there was I don't know if folks are aware, the state released version 2 of their ops manual last week, and I was trying to get that up to kind of see if there was any significant change in the requirements there. And so it sounds like what you're thinking, Mohammed, is that we would not need to establish some sort of a direct SCN MCO data file sharing process based on the assumption that this information could be accessible in MEV as a part of the navigation workflow.
I think that data sharing will be required for example, the flag changes. I think that's still that the process needs to be built for that.
The enhanced one. Okay.
Right,
Okay.
the enhanced service member file changes to that.
Yes, agreed.
Okay,
Agreed on
the
that.
eligibility stuff that, like, for example, the example that I used, we found out someone is pregnant, you didn't know, that could now be kind of eligibility for an enhanced services. We got to get that information over to you.
Right.
Okay.
Right.
And then for the flag changes, would folks be amendable to some sort of a secure file sharing process, or do you think we can solution for that via another process? I'm just thinking of the type of information that's being shared, and we definitely wouldn't be able to send that via email or something like that. Like, should we head down that path as kind of our proposed solution to figure out how we could solution for this? Or do you have other thoughts?
I know. Obviously, I can't speak for the other MCOs on this, and
Yeah.
there'll be differing answers on this. But I know we'd use, our vendor hyphen to connect with you, PHS, like we have in the past. That's what we'd likely be our primary source. But obviously, keeping in mind operational limitations.
And noting in the chat that United will get back to us on the preference for bidirectional data sharing.
Okay. Okay. Well, it sounds like at least we have some more informed thoughts here around what we would need to solution for via this process versus what information the SEN's navigators could potentially access directly from MEV for more real or near real-time enrollment related information.
Super. Keisha, do you feel like there's a time frame we need to discuss in terms of when we would need feedback around the SFTP, if that is an option, and getting some like sample file formats or some sort of template around that?
I mean, I think this is an ASAP item. I just think through if we go down that path, we'd have to involve our analytics and think about, format, et cetera. So I know one of your next steps is to definitely get time with all of our MCO partners to flesh out some of our more MCO specific implementation activities. So I think the sooner we can align on the process and how we're sharing data, the better, given that it might require a little bit of prep and legwork to get us up and running and ready for 1/1.
Thanks. Okay, that makes sense. Okay. I think we can move ahead to the next.
I think there's some others on the slide
Oh.
that we haven't covered. I
Okay.
think one of the other things is, the state, leaves the door open for, our health plan partners to participate in the network and screen and navigate on behalf of the network. And I was just maybe trying to get a sense from any of the plans that are represented on the call, if any of you are considering wanting to do that for 1/1, is it, or, I know we've had a discussion with a few, and some of you have said, at least not for day one, but we'll keep the door open in the event that we want to do it in the future. Just trying to get a sense of we should be planning when we think about training, onboarding, if we should be syncing up with you all to think through your role as potential screeners or navigators on behalf of the network. And for day one.
Yeah. This is Esther Conte from VNS Health. I'm the Vice President for Care Management here. And for us, not planning to take on the responsibility on day one, but thinking about it down the road, we really want to just partner with the SENs to complete the screenings. Of course, we will be collaborating when we identify a member who has not yet been screened by your teams and make that referral. So I have been thinking about referral process, data exchange for sure, and making sure that, it's a smooth process and it doesn't impact on timeliness, right? To meet that member's needs. And so, at least for me in VNS Health, my position is have this SENs take the lead on screening, but partner with us as a health plan to, jointly collaborate on identifying, if we find someone, how do we link that person, and how I've been strongly thinking about the end loop, right? Closing that loop. Yeah, that's where we wanted to be, but not on day one to screen for us. At least we're looking for you all to probably lead that, and down the road, maybe we can reevaluate.
Okay, that helps. I mean, we just want to ensure that if any of our partners were considering it for day one, we're interested in doing it for day one, that we can ensure you're accounted for as we start to roll out training and onboarding activities for the network.
Yeah, and it seems like there's some consensus in the chat as well that AmitaCare is not considering this, or is considering this, but not for day one. Health First is not planning on doing screenings for day one, and similarly, United is not planning to screen on day one.
Okay.
Thank you. That's great to know. And the next topic was, how does the member grievances or appeals process work? And wanted to get your feedback there in terms of methods you propose or prefer for the grievance process.
Allison, perhaps you can kind of just clarify the requirement for us around member grievances and appeals as an SCN.
Can you cover that, like, Keisha?
Sure. In the ops manual, there is a requirement that we just have to have an established way for a member to file a grievance or appeal, I guess, against the network, and solution for that. And so, our assumption is that there will be a way for, the member to do that. We're thinking maybe on our website. I think that would be the only kind of external facing means for a member to do that. But there's also some additional language around, I don't want to say second level, but there was also some additional language in there around the MCO being involved potentially in the process is some sort of like a second level review. Like what's your take on the requirement here in solutioning for this above and beyond knowing that as an SCN we need to have a process in place for members?
This is Tina Radovich from United Healthcare. So from at least our initial perspective, we're hopeful that if there are any member grievances, they could be handled directly with the SCN, but certainly if they do feel like their grievance is not met via that route, we are happy to have them go through our standard grievances and appeals process. Not sure if other managed cares are approaching it in the same way, but that's just how we're thinking about this.
Yep. At Health First, similar approach with Health First, yes.
The MediCare, any grievance or complaints we receive on our end will be processed through our regular appeals, our grievance and appeals process.
Okay, that makes good sense. Are there any other comments around grievance and appeals? So the first tier, if you will, would be directly with the SCN. And then if the member doesn't feel their needs have been met in that process, they could follow up directly with the MCO through your existing processes.
Yes.
And I think I finally found the manual, and I think this all aligns to the requirement in the manual, and that, you know, we have to have an established process for grievances, complaints, and reportable incidents, and the state defines what those things are. And then, you know, as appropriate, SCN lead entities may escalate complaints to the members' MCO consistent with existing MCO and OHIP processes. Members may also submit complaints directly to the members' MCO or to OHIP. And then there's, of course, the language that says additional information on how they can submit complaints directly if forthcoming. And then it does say that from an SCN perspective, we will be reporting on this on a quarterly basis. So I think, you know, the assumption align, or the requirement aligns with our assumptions. Like we assume that we would be kind of the first level, but there also just needs to be a pathway for members to submit complaints directly to the MCO or OHIP. And I know for most of our health plan partners, if not all of you on the call, right, you already have a defined process for that, and we'll continue to follow that process.
Okay, that sounds good.
So
Thanks,
this
Keisha,
is
for the
Anne Marie
reference.
Murphy from Medicare. I just want to add that we would add that to our bi-directional communication. You know, identify the person, identify the phone number. Is that what you're thinking?
Sorry, am I on mute? You mean in terms of us informing you of any
Yes.
complaints or, I mean, I think if you want that, you want to receive that information, yeah, we should definitely solution for it.
Right, Keisha, I'm just starting to put together a list of the leads on the Medicare side on who you would be able to get in touch with, which we would match on your side. So I just want to confirm that.
Are you asking for our contact or just confirming that I'm in agreement with that
Yes.
suggestion?
Yes. Are you in agreement?
Yeah, I mean, I think if the MCOs want this information, then we should definitely solution for getting it over to you.
Mm-hmm. Thank you.
I'm sorry, is that the information being someone submitted an appeal with you all?
Yeah, our agreement, yeah.
Yeah. Okay, no, that makes sense, I think, because I think if we're gonna say that the first step is to work with the SCN, we would need to know if they worked with the SCN first.
Okay,
So that would be helpful.
okay. So it sounds like at least the two things I have is, you know, us kind of ensuring that we establish a process for is, you know, the eligibility changes, and then also sharing grievances and complaints and incident information with the MCOs as well.
And Keisha, this is Anne Marie again. I would add claims to that
Yeah, we've
list as well.
yeah, claims is definitely on the list. This is an area where our plan partners would be working very closely with Unite Us, our data and IT platform technology partner to solution for the social care claims process. And I know know Unitas was on the call earlier, and Allison, there might not be a slide on this, but I know Unitas has already reached out to most, if not all, of our plans partners to start the solution for that process. Have you heard from Unitas yet, or are you still awaiting kind of engagement?
I'm not sure. We heard from Unitas yet.
What plan are you again? I'm sorry.
MediCare. I know
MediCare.
that
Okay.
Kevin, if you could chime in, I think we're trying to set up a meeting with Unitas.
Okay, well, I know Unitas, I know Mark was on the call earlier, but if not, I can definitely send a message to them after the call to get them connected to the right person on your side.
Hey, Keisha, this is Mark. I'm still here.
Yeah.
Hey,
Okay.
Mark. We're very familiar with Mark.
Ah, okay, great.
Yeah, and we're contracted with Unite Us already at a MediCare. I think what we're just trying to do, and I've been in contact with Allison, we're just trying to do have some individual meetings, which I imagine a lot of people on this call are, with with our other two SCNs, just so because you guys are really ahead of the game. I mean, these meetings are wonderful, and we really appreciate them because we're getting a lot of information. We're not to disparage anybody else, but we're not getting as much information from some of the other SCN. So we're looking to try to get some contacts, or at least a one-on-one meeting with them, so we can get this same type of information and processes running.
Well, that's refreshing to hear, because I was concerned that it was the opposite. I mean, I think there's a lot of areas where we're still waiting for guidance from the state, and so we.
Yeah, well, I think we're all waiting for guidance from the state. That we know, but I don't know if anyone else on this call has heard, from Somos and the Staten Island group. We've reached out to them, just to set up a one-on-one. So, but I haven't heard of any meetings like this that are already set up. So, yeah, happy to, if anyone hears that, to put it into the chat. But we work very closely with Unite Us and Mark and their group. So.
Okay, great.
Very
This
good.
is Ron from Elder Plan. Yes, we have heard from Unitas, Gracious at Unitas, and we're from the claims department, so we have had some contact with Unitas, and we've talked about how we'll move forward with claim submissions and things like that.
Okay.
Thank you. That sounds good. Good collaborative work underway on that connection there with Unite Us. And at the end of the deck, I have a bunch of resources. So if by chance anyone's not connected, you'll have that available as well, the contact information. Okay, I think we can move to the next slide around payment and claims, timely topic. As it sounds like you're working through and are getting to be well aware, the process for payment and claims, we just wanted to review and discuss in terms of the handoffs and the timing. And the distribution of the PMPM payments to the whole NYC to cover the cost of the HRSN screening and approved enhanced services is the discussion topic, as is the processing of claims submitted by our SCN for HRSN services provided to the members. So the first item would be to confirm the PMPM administration timeline around payments for screening, navigation, and enhanced services, that the MCOs will bill eMedNy for the PMPM on a monthly basis, and the MCO will make the PMPM payment to the SCN by the 15th of each month. And the SCN will provide social care claims to all contracted MCOs for enhanced HRSN services provided to members. And I believe that's within 90 days. So overall, just to confirm and review, I think there was a question from one of the plans around the phrasing of the 15th of the month, understanding which month is being referred to. Is it Fidelis? You might be on the call. I thought it would be useful to touch on that.
I'm not from Fidelis, but we also had questions about that 15th of the month, because I think from the timing, like the workflow timing, you know, the process that we've laid out here on this slide starts the first of the month, but the payment timeline will actually pull out to the 15th of the following month. That's been our discussion understanding. I don't know if other health plans.
Right, same on our end. Even in the guidance that the state has released, they have this, I guess, this image or diagram or workflow that shows that we would bill at the beginning of the month, we'd receive payment at the end of the month, and then we would make payment on the 15th of the subsequent month.
So basically the first payment's not coming till February 15th.
Yeah, exactly.
Yeah.
It doesn't sound like there are any questions from your end on it. Keisha, did you have any questions on this item from our side?
No, I mean, I think that aligns to my understanding. The 15th, the February helps because I wasn't quite sure when the first payment would take place. I didn't know if there was like a December process where the first of the month for the very first one was December, and then the first payment would be January 15th, but it sounds like it starts in January and the first payment to the SCN would be by the 15th of February. So that helps to clarify the timeline.
Yeah, they seem to have originally been talking about a first payment that was going to happen in December, but that seems to be taken off the table.
Okay, and I think I might have seen something in that recent FAQ about that. Okay.
Yeah, that's very helpful.
I mean, I think the only other item here, and I think this is one where we just have to solution for in our one-on-ones with each of our plan partners, is just kind of the whole administration process of kind of the handoff of the PMPM payment from you all to the SCN. I think that's a conversation that we'll have to flesh out in our one-on-ones with you, to also include, you know, our finance team in those discussions.
Great, I'll add that to the running agenda. Okay, excellent.
Sorry, can you go back to the last slide for a second? I just want to ensure we covered everything. Okay. Is there anything else regarding kind of payment and claims that should be front and center, or, you know, are on the list above and beyond, knowing that Unitas is working with you all on solutioning for the social care claims process, and also knowing that we just need to flesh out the process for the PMPM payment administration? Anything else regarding payment and claims that we should be solutioning for 1/1 that we haven't discussed? Okay.
All right, thanks so much. Next we have a touch point around MCO responsibilities on the MM core report, and updates that are required with the new service model with the SCN. OHIP will integrate the new HRSN services funded through the waiver into existing reporting. The MCOs are to coordinate, accept, store, and report social care claims submitted by the MCOs by the SCN IT platform, and the MCOs will work with us to ensure required data elements are provided to the MCOs for submission to OHIP. As I understand it, the guidance for this would be in the MCORS category of service utilization and cost reporting guide and the ODS Encounter Standard Companion Guide, which are currently being updated. I don't know whether you all have received a target date for that, but the last I saw was just that the state would make it available by service go live. So I think we're not able to really get into what the state requirements would be on the reports.
Well, I think the question maybe for our plan partners is if you know more than us based off of what we've seen in the ops manual, it sounds like there will be SCN specific information that will feed this quarterly report that you submit to the state. And it sounds like maybe some of that information could potentially come from the social care claims, but I don't know, just based off of the wording in the manual, if there's additional information that the SCNs will need to provide to you to feed that report above and beyond what you would be getting in the social care claims, or if it's still TBD because you don't know, and we don't know enough yet about what some of those data elements will need to be for this report. And sounds like maybe we're all just waiting for the state to provide a little bit more guidance here before we can figure out whether we need a solution for any additional information above and beyond what you would be getting on the social care claims to ensure that you have what you need from the SCN for this report. And I see, go ahead.
Yeah, that United has not seen any additional guidance on this from the state yet.
Okay, so I think this is one that we would just kind of keep on the list as a potential implementation planning activity to understand what information you as our plan partners would need from the SCNs, and whether all of that information that you would need is coming over through the social care claims process, or whether we need to share additional data above and beyond that, what those data elements are and how we're going to get that information over to you timely.
Right. Keisha, it's Anne Marie again. All MCOR data is based on claim submission. So if there's anything new, we're waiting for the billing guidelines as well to see if there's anything different on submission of claims. So it's all based on claims claims paid. So, and then our first report wouldn't be due to the state. We would be reporting first quarter data for the first an enhanced report that include the SCN information.
Okay. Okay, well, that's good to know. So perhaps you'll get what you need through the social care claims, but maybe TBD pending additional guidance from the state.
Yep.
Okay.
Thank you. Great.
Any other, and I just want to confirm that, again, this was based off of the ops manual, and this was the only report referenced as an area where the SCNs may need to feed information to our managed care partners for your reporting. I'm not aware of any other kind of state required reports above and beyond this that would kind of require that we feed information, but please do let us know.
All right. as I think you all have noticed with the flurry of emails back and forth, adding folks to the email invite for this meeting, we really do request from you all to share with us your point of contact for implementation, planning, and the contract signatory. And as Keisha and I had mentioned earlier, PHS will be setting up one-on-one meetings with plans this week. And I know several of you have emailed already proposing times. We'll coordinate with our support teams on this side to make sure that those meetings, we're able to answer your questions and collaborate further on the setup and everything for the SCN. And all the collaboration we just covered in the meeting. If there aren't any questions around that, just wanted to share the last slide just to cover a couple of resources for you all. As you referenced early throughout the meeting, there's the OHIP FAQ that was released on 10/10. We shared out a recording rather of our previous MCO meeting that was in October for your reference. We're looking forward to OHIP sharing out the operations manual more broadly. Was there a question? As we discussed, the Unite Us contact for you all is Mark Natale. It sounds like you're well in touch with Mark, but if you're not, his contact is shared here. Just in terms of the contacts on our side, and we'll ensure that our finance team can be available to join the one-on-one meetings to the extent of getting the payments and claims data over to both parties such that we can get that set up. But in the meantime, Sarah Tall is the contact around electronic payment setup. And I believe a couple of you have already asked about that, just in terms of some of the data points that you need on your side to make sure that the payments are all teed up, the processes in your systems. So we do have a little bit of time. I want to just make sure if you had any questions in the chat or additional questions or comments. And again, we'll be available to convene one-on-one with you and go through whatever other topics you've got burning on your list of things to do and in the coordination between the MCOs and our SCN.
Thanks, Allison. I think the only other thing that I would add is I think the list on slide 4 or whatever, like that mini list of kind of high level activities or milestones are, from an SCN perspective, and Relisa, if you can go back to that slide, these are the things that, based on our review of the ops manual, that we feel that we need a solution for with your plan partners over the upcoming weeks. And so this is in some ways kind of our very high level, work plan of we need to flesh out, these things with you, our partners over the upcoming weeks to get us to, 1-1. And so I think this is the list that we are anchoring back to start to have these one-on-one conversations with you. Some of them we started to touch on in today's meeting, given, the ideal that we can be as consistent as possible and how we're doing some of these things with the 15 plans that we as an SCN need to contract with. But, if there's anything, and, maybe I'll ask that Allison, as you schedule these meetings, share this list or kind of maybe a more cleaned up version of this list. If there's anything else that you don't feel is on our radar that we will need to solution for, working collaboratively with you over the upcoming months, let's just kind of get it added on this list for visibility to ensure that we are having these conversations with you and making decisions about how we share information, either, manually or electronically, and that we all feel like we've got everything covered from an implementation planning perspective. Does that make sense? And if you identified any gaps just during this call, like things that you think we need a solution for together, that we haven't discussed or you don't see on this list, please do let Allison, know so that we can just get it on our tracker.
Keisha, along that vein, I just wanted to note, the only chat feedback that we didn't directly respond to was just a clarification for the actual flow of the member, from screening to navigation and how the MCO plays a role in that. And I believe we'll be going more into depth both in the one-on-ones where it makes sense and can note that as a topic for future meetings. So just wanted to point out that we'll note that.
Okay, and then the only other, thing is, just please bear with us. I know there's a lot of emails circulating and, we will definitely work to ensure that we have one-on-ones scheduled where they're not yet scheduled with you no later than end of week so that we can start to flesh out some of these decisions individually as needed. Any other questions, comments, or concerns as it pertains to implementation planning or how we will work together or questions that we have for the state? Probably a lot at this point. Have the plans received the V2 of the ops manual yet, or you're still awaiting that from OHIP? Unfortunately, we can't share it, but I know last time I believe the state sent it to, or the managed care organization soon after they shared it with the SCNs. Oh, it looks like you have. Okay, great. Okay, looks like you received it.
Yeah, very good. I mean, I think that's really important that we're all referencing the same information when we go into these conversations. So that's great to hear. Well, I really thank you all for joining. And I also really appreciate you letting us know if there were others you wanted added to the meeting notice. We've made note of that, and going forward, we'll be sure to include your full group. Again, thank you for listening in, and we'll share out the recording with you all.
Thank you.
Thank you.
Thanks.